My name is Alice Saul, and this is Laura Laslett. I'm a postdoctoral research fellow, and Laura is a senior postdoctoral research fellow at the Menzies Institute for Medical Research. We are also lucky enough to be the academic leads for several online courses, to which are currently in development or we're running at the Institute. I'm going to give this clicker a go. As Des just very kindly mentioned, Dr. Susie Claflin left this role last year, and I was actually going to say as well that she is the definition of a rock star. I just wanted to take this opportunity to thank Susie for all her contributions and wish her all the best in her future endeavours. So this flyer is in your delegate packs. It's also available on the trade stand, and it gives you a bit of an overview of the courses that we have running or in development at the Menzies. The course I'd like to start with to give you an overview of is the Understanding MS. Now, some of you may be aware of this course already. It is a free online course. It's run over 6 weeks and it's funded by MS Australia and MS Plus. And the course covers a variety of areas. The biology of MS, diagnosis and symptoms, risk factors, strategy for managing, and also just living with MS generally. It's really for anyone with an interest in MS, so that could be those of you living with MS, your families, carers, supporters, advocates, or anyone working in the field. Okay, so when we refer to these courses, we generally refer to them as MOOCs, and as I think Chris touched on it earlier, a MOOC stands for a massive open online course, to which I started this role. I'm quite grateful there's an acronym. So to date, in reference to the Understanding MS course, we've just completed the 9th iteration of this course, so this course has been running we're in our 10th year now, and to date, over 37,000 people from 170 countries have enrolled in this course. So we've had quite a few people. Of those enrolled, 40 to 50% have completed it. Now that might not sound like a large amount for online MOOCs, this is actually a huge percentage of completion rate. In our feedback survey, we found that 97% of those who completed the course would recommend it. And additionally, more importantly, 63% of the course participants reported applying what they learned in their everyday lives. It is currently ranked in the top 10 best online courses of all time, and this is ranked by the Class Central. And the Class Central is a company that lists and ranks over 150,000 online courses, free online courses globally. And even more importantly, research that we've undertaken found that people who undertook the course substantially improved their knowledge about MS, and people living with MS significantly increased their health literacy and self-efficacy by doing this course. It does have regular intakes. As I mentioned, we've just finished the 9th iteration, but we do have another one running in September if you'd like to take it. As I mentioned as well, the flyer will be available in your delegate packs, but it also will be on the trade stand. I'll now pass you over to Dr. Laura Laslett, who will give you an overview of the courses that we've got currently in development.
Thanks, Alice. So obviously with the Understanding MS MOOC so successful, people began to ask, well, this is great, this is a general course, but what about other stuff? We'd like to learn about other things. And so we kept being asked for more shorter courses on specific themes. This one? That one? How many people with PhDs does it take to work these things? There we go. All right, so we thought there was scope for several new shorter MOOCs, and that would be about 3 weeks as compared to the Understanding MS MOOC that's 6 weeks, exploring topics in more depth. And importantly, all of these things, there's so many things that can be done, but everything needs money. So we got money from the Medical Research Future Fund to run the mini MOOCs, and so that was great. So at that point, we can start planning what are we going to do with them. So a scoping review was done in July 2020, and the people who were doing that looked at what is already available and where are the gaps. And this review identified 7 possible topics. And so at this point, the first thing that was done next was to do workshops with stakeholders. So predominantly these were people working in MS organisations, and they suggested that we move forward of those 7 topics, plus a new topic that didn't pop up in the scoping review. And then, of course, we've heard lots of today about consulting with consumers and consumer engagement. So the next thing that we did was to talk with consumers, and we asked them to rank the topics that had been suggested so far, to rank the topics that had been suggested and to come up with the top 4. And the final 4 topics that we came up with were mental health and MS, deciding about disease-modifying therapies, ageing well with MS, and supporting our MS carers. And those are the topics that you will see on the flyer. So they're the ones we've moved forward with. And also in this consultation with consumers, we also asked consumers not only which were the 4 most important topics, but also to go into a bit more detail about what they'd like to see within those topics. Because some of these topics are huge. There's so many things you could include in them. And these courses will be delivered over the next 12 to 18 months, and the release dates are listed in the flyer. So they won't all be released at once. They'll be released at different times. And unlike the Understanding MS MOOC, which is done kind of in rolling waves, these ones will be generally available once they're up. So let's look at the short mini MOOCs in a bit more detail. So the first one that will be released is the mental health and MS one. And the goal of this is to increase understanding about mental health and how anxiety, depression and MS interact to affect the health and the lives of people with MS. And the content includes up-to-date evidence-based information about mental health and MS. And this is for anyone with an interest in mental health and MS. So let's move on to the next one, which is deciding about disease-modifying therapies for MS. So the goal for this one is to describe what disease-modifying therapies are, how they work, and how to help people living with MS make informed choices about DMTs. So the content includes up-to-date evidence-based information about disease-modifying therapies, and this is for anyone with an interest in using DMTs to treat MS. And the academic lead for this one is Dr. Alice Saul, and she was also the academic lead for the Mental Health and MS MOOC, mini MOOC. So the next one on the list is the Ageing Well with MS mini MOOC. And the goal of this is to describe what normal ageing looks like, what's different for people living with MS, and whether that matters. The content includes strategies for healthy ageing and advice for planning for the future. And this is for anyone with an interest in MS, and I'm the academic lead for this one. So moving on to the 4th mini MOOC, this is the Supporting Our MS Carers mini MOOC. The goal of this is to describe practical strategies for enabling the physical and emotional support of our informal MS carers and supporters. And the content for this one includes information about personal strategies and resources for carers and supporters of people living with MS. And unlike the other 3 that are really designed for people living with MS, this one is really aimed at the carers, although there will be many people who will benefit from this as well. And the academic lead for this is Dr. Julie Campbell, who's sitting in the audience today. So in terms of consumer involvement, so there's already been some consumer involvement in this project up to date. We had the first lot of ideas come in from the people doing the Understanding MS MOOC. We had some scoping reviews where consumers had some early input into this. And we made sure we did more than one of those for consumers because we actually needed a bit more input. And one of the things we want to do before we release them is to actually get further input from consumers. So we relied on consumers to help us work out what should go in them. And so we, as academics, have moved forward with that. But of course, there can always be improvement on what's in the brief. So that's the next thing, is to get consumers involved in helping us work out, is what we've done in these, right? Have we pitched it right? Is the content right? So we'd love to get your feedback on our short course content. So please come and speak to us at the trade table at the end of the session. So we've got sign-up sheets to put your name forward to be part of the earliest people to get a look at these courses and to give us feedback. And you can also sign up to do the Understanding MS course if you wish. So new content's added yearly. So if you've already done this a couple of years ago, it's always good to have a refresher, but if you have done this for the first time in a few years, there will be new content that was not there last time. So projects like these are huge. There are always a huge number of contributors. So in terms of the Understanding MS MOOC, of the people there are listed include Bruce Taylor, Alice, who's the current academic lead of Understanding MS, Susie, and some other people listed there. This is not just academics, but includes a whole host of general staff and consumers as well, who are essential. We've got our media team who are here today, but we've had a lot to do with them over the time, and our funders here, MS Plus and MS Australia. Wicking has had staff who have helped with the back end of things, our lived experience and clinical experts, and of course our consumers. And in terms of the mini MOOCs, Ingrid is the project lead for the mini MOOCs, and Alice, myself, Julie and Susie have all been academic leads at one point in time. We've got another suite of amazing professional staff, Rachel, Tash and Viv, who's also on the Consumer and Community Committee, or is also a part of the regular team that meets regularly, and media and our funders, MS Plus, MSWA, MSSA Northern Territory, Australia and MSIF, and the Wicking is involved in this as well with back-end stuff, our lived experience and clinical experts, and again our Consumer and Community Committee. And the project funders for this are the MRFF. This one is actually not funded by the MS associations, but it is funded by the MRFF. And with thank you to our event contributors as well. Thank you to anyone I have missed in that list. Thank you.
Well done.